Assalamualaikum warahmatullahi wabarakatuh. Good morning to all participants and honors to meet you in beautiful day. I would say to thanks for Dean Faculty of Nursing Andalas University and also to the all speaker from Indonesia and also other country. Yes, I am Roro from Faculty of Nursing Universitas Indonesia. Today I will share about our experiences and also our study with title Online Learning Challenges in Continuing Professional Development during COVID-19. Let me introduce myself. I am professor in Faculty of Nursing Universitas Indonesia and today as head nurse credential commission at Hospital of Universitas Indonesia and other activity. I also as surveyor of hospital accreditation, head of academic senator Faculty of Nursing Universitas Indonesia, nursing compartment secretary of Indonesia Hospital Association, team of grand design of healthcare human resources, nursing collegium secretary of Indonesian Nursing Association, human resource and financial manager in Faculty of Nursing. This is the past years, and then team of Indonesia Nursing Career Radar, team of Nursing Information System Development, and the last expert team of Directorate Research and Community Service Universitas Indonesia. Please visit to my YouTube channel with title Ruang Sharing Keperawatan, and also you can visit to our web with title sistemkeperawatan.co.id and cpdonline.co.id and simpro.sistemkeperawatan.co.id. Start to the agenda session. The first, I will share about introduction, then continuing professional development during pandemic era, and then implementation online learning during pandemic era, and the last is conclusion. We know COVID-19 has affected the life and health of more than 1 million people across the world, and this overwhelmed many countries' healthcare system and of course affect healthcare providers such as nursing fighting on the front lines to safeguard the life of everyone affected. The major issues facing nurses in Indonesia are the critical shortage of nurses, bed, and medical supplies, including personal protective equipment and, as a review indicated, physiological change and fear of infection among nursing staff. The implication of this condition might have to provide support and identify the needs of nurses in all affected countries to ensure that they can work and respond to the crisis with more confidence. Why nurses need continuing professional development during pandemic 19? Nurse continuing professional development or CPD improve the quality of nursing care, patient safety, nursing satisfaction, and healthcare costs. Previous study also said CPD may also improve knowledge, skill, attitude, and critical thinking competence. The learning needs of nurses during pandemic included skill related to donning, doffing, PPE, personal protective equipment, disinfection, skill and performing nursing procedure, how to reduce a job stressing, and how to breaking bad news. Previous research also give some concluded competency corner improve the satisfaction of nurse. In the previous research, I developed we call corner competency system with two model blended learning and deliver to the nurse with two system conventional face-to-face model with pre and post-test evaluation and also combined with online reflective learning. There is a learning media system, learning management system we call student center e-learning environment. This is the owner by Universitas Indonesia. This is the sample of one courses about patient safety in healthcare system. Impact of corner competency uh, has significant difference in satisfactory perception between the conventional and the corner competency system. System indicated by the increases satisfaction, nurse satisfaction with p-value 0.0001. Based on the result of our previous research and also this condition uh, regarding COVID-19, we have the plan to delivering CPD using online learning. In the COVID-19, the coronavirus disease undoubtedly pose a big challenge to the education system worldwide, disrupting the normal teaching and learning trajectory. Let's go to know about definition continuing professional development. Continuing professional development is a process. The process of tracking and documenting the skill, knowledge, experience, and gains both formally and informally through work beyond any initial training. A record of what is experiences, learned, and then applied. In this study, have three goals. The first, how to develop learning climate for nurse during pandemic era, and then comparing how field implementation of patient safety before and after using CPD online learning. And then the last, to evaluate nurse satisfaction using CPD online learning approach. In this study, we have implemented numerous creative strategy to combat the crisis using various software apps such as Zoom, WhatsApp, e-learning, and YouTube. we have new learning management system we call CPD online.co.id. This condition delivered by asynchronous and synchronous system. Participants of CPD online learning in this study are 510 nurse bachelor, we call nurse, from 6 referral hospital of Covid-19 in Jakarta and Depok. Sample selected using purposive sampling with criteria inclusion are literate in technology and also minimum education background is nurse. All participants divided to 6 teams based on originally from of hospital. This is new learning management system, our dashboard, and you can visit to cpdonline.co.id. There is our dashboard. We can see all courses and also activity or participant and also how many participants in the learning management system. On our study, every module have the same structure. In every module, we have 2 webinar and quiz, and then case study, reflective learning, and publication of review or review publication. Our curriculum will finish on after participants take a course and learning and finish complete examination in 80 training hours. And we got 5 credit from Indonesia Nursing Association if each participant completed all of the assignment of courses. Every week has 12 hours and divided to 4 hours synchronous with Zoom. Every week only one meeting Zoom, and then the another hours 8 hours conduct to independent learning or asynchronous using WhatsApp group and learning media system or e-learning. Each group has 3 facilitators. Role of facilitator in order not only to complete of courses but also to stay in constant contact with the nurse or learner. This virtual class of e-learning was initiated to grow the certainty and confidence for nurses to deliver care during pandemic era. In the study, we also transform from facilitator center to the learner center. We have 6 modules. The first module describes how to learn using online system, such as how to download and then replay assignment in the learning management system, cpdonline.co.id. www.co.id, how to interaction in group WhatsApp, and also how to learn using Zoom meeting and to learn view and download video from YouTube. In the first module, also delivery material about how to learn more active learning, transforming from facilitator center to student center learning. The second module is caring during pandemic, and then patient and family right. The third about patient and family right, and then effective communication during COVID-19, infection and prevention control, and risk management. Every module has the same structure. Have two webinar with two quiz. Before answer the quiz, participant must view video in the webinar. And then case study about a case from journal or evidence-based practice, and then we deliver assignment discussion about comparing cases with condition in hospital. And then publication review about learn new result of research, and then evidence-based practice, and plan of implementation in his or her hospital. And the last, learning reflection about how feeling after learn, view video, and then discussion about comparing cases to the reality in hospital and other. There is a synchronous session. Every week only one session meeting using Zoom, and each synchronous session has agenda, sharing from hospital, and then discussion forum, evaluation, progress, and reward for 3 best participants. If nurse cannot attend in synchronous session, so nurse can replay from link YouTube. There is the example of sharing and discussion by synchronous from one hospital, and then every week change another hospital, share about the cases, and then also how to direct care in COVID-19. The same, this is reflection learning. Every participant can speak up about learning reflection in the synchronous session. How to evaluate CPD only. Before conduct CPD online, we deliver questionnaire, and then after 6 weeks or 80 hours training, we also deliver the same questionnaire, and then we compare perception of patient safety implementation before and after CPD online. We can see in the picture before and after describe increasing feeling of patient safety implementation from participants. Besides that, we also deliver questionnaire by G-form to explore satisfaction, nurse activation using CPD online. There is a result of the satisfaction of CPD online implementation. You can see the top of satisfaction nurse in the knowledge sharing, and then the little is time scheduling. The mean or average of nurse satisfaction in 81%. Okay, we continue to the discussion. After got the result, if CPD online can improve satisfaction and also feeling of patient safety implementation, we can conclude this result refer to the previous result. IMES states CPD plays a vital role in preparing nursing to work well and remain resilient during challenging pandemic situation. And then this learning system also helps nurses to utilize the learning opportunity without being physically there with the facilitator. And when the learning happen at learners' convenience, it is known as asynchronous. We found some barrier of implementation. Retention of participants only 30%. Only 30% participants done and finish all assignment and all courses, and another not yet finished. The reason of the limited retention because some nurse take full-time working hours, so have a time constraint and then very difficult to manage for individual learning. Another constraint about language because usually case study or publication review using English language. Nurse also not familiar with student-centered learner such as case study and publication review because in the Covid-19 era, usually the nurse learner only take some courses from teacher or facilitator with one direction approach, like only seminar from webinar. And then because feel too many assignment, lack of motivation, poor concentration, and other significant learning difficulties. And then the last barrier are connection and technical barrier. This condition refer to previous research that said one of the main challenges is implementing e-learning is the technical difficulties such as lack of technical support, poor connectivity, and outdated computer system. For the lack of motivation, poor concentration, and other significant learning difficulties, need some stronger facilitator. Continuous engagement and motivation from the part of both of nurses and facilitator is very essential in meeting the CPD needs during this crisis. The conclusion our research: the first, CPD plays the vital roles in preparing nursing to deliver care and remain resilient during challenging pandemic situation. And then the second, a structured and well-managed CPD program will lead to valuable impact for nurses. And then the third, the role of facilitator was to motivate and provide the information about new information, new courses, examination, and evaluation. And then after CPD implementation in this research improve patient safety feeling implementation. And then nurse have satisfactory perception using CPD online. CPD online could be an alternative model of continuing nurse education during pandemic era and also in the new era adaptation. Thank you and wassalamualaikum warahmatullahi wabarakatuh.